Hi, my name is Kylie Meyer. I'm a postdoctoral researcher at the Caring for the Caregiver program at UT Health San Antonio School of Nursing. I'm very excited to be talking to you today about planning for the future, particularly if you're caring for somebody who's living with dementia or another kind of progressive illness. I want to thank Dr. Carol White and Kathy Beer for putting together the slides for this presentation. When we're talking about planning ahead, we're thinking about your and the care recipient's medical, legal, and social well-being. So we're looking at multiple aspects of a person's life. Planning ahead is important at all stages of life, but it's particularly important if you're living with or caring for somebody who's living with a progressive illness like dementia. So this might seem a little bit obvious, but it can be tougher to do when you're actually in the position of having to care for somebody with a progressive illness. The first step to planning ahead is thinking about your future. Nobody knows what's going to be around the corner next. So in the image on your right, you can see a picture of Pocahontas from the Disney movie. And in the song, and I hope that I don't get this stuck in anybody's head, she's talking about two different directions she can take on the river. And she doesn't really know on one side, are you going to get rapids or are you going to have calm waters? You just don't know what's around the river bend, right? And similarly with caregiving, when you're planning ahead, you kind of have to be thinking about being ready for multiple kinds of futures. You don't know what the progression of an illness is necessarily going to be, or possibly what other factors in your life that could come up while you're providing care that could affect your caregiving situation. But by planning ahead, you do get to bring back an element of control into your life. In thinking about planning for the future, I want to share this diagram to help you think about the different care needs that you may have as a caregiver, as well as different consequences of caregiving. So on the top of this diagram, you see the different consequences of caregiving laid out in terms of financial strain, physical strain, social isolation, some of these not so good things we know that caregivers are at a greater risk for. Although I do want to mention that a lot of positive consequences are missing here too. Things like having a rewarding relationship with the person you're caring for. And on the bottom, you see different needs that caregivers have, as well as a list of resources to meet those needs and hopefully try to prevent some of those not so good consequences of caregiving. You'll notice in this diagram that the different needs of caregivers actually change along the care continuum. What we're trying to do in this presentation today is help you to think about what your needs might be in the future, as well as what they are now, to help to prevent some of these not so good consequences. Before we dive into issues like advanced care planning and planning out financial needs in the future, I first want to talk about self-care. Oftentimes this isn't something we're thinking about when we're talking about planning for the future, but if we think about the future as being tomorrow or next week, I think it kind of fits in. Self-care activities include have-to-do activities like eating nutritious meals, exercising, and going to your doctor's appointments, as well as want-to-do activities, things that are enjoyable, that help to make you feel refreshed. And these things, both of these things, are so important, and they don't just happen. When caregivers are juggling a lot of responsibilities, it can feel difficult to fit in self-care needs. But planning ahead can be so important to making sure these things happen, so you can overcome roadblocks that can prevent these from occurring. So that might be scheduling appointments, making sure there's respite care available so you can go do what you need to do. So that is having somebody else available to take care of your family member so you can leave the home. So we're thinking about planning for the future. We're thinking about taking care of ourselves now to ensure our well-being long into the future. Now we'll talk about some of the things that caregivers typically think about when planning for the future, like sorting out your financial issues. Financial planning is important at any stage of life where you're facing a transition, whether you're going off to college perhaps as a young adult, or currently you're facing retirement where you may change in your amount of income that you're taking in and the costs that are going out, what you're paying. Receiving a diagnosis of dementia can also be a life transition that can alter somebody's financial resources. You may be paying for more out-of-pocket costs related to caregiving. You may need to change residences. You may need to look at long-term care. So this is an important time to take account of what your resources are, what your family member who you're caring for, what their resources are, and what those needs are going to be in the future. Another important consideration is trying to anticipate times when you may not be able to make financial decisions or health decisions for yourself, or when your loved one, the person that you're caring for, is in that situation. So a lot of times when caregivers are thinking about advanced care planning, they're thinking about going to an elder law attorney. They're thinking about signing papers and legal documents. And I want to encourage you to broaden your view about what advanced care planning is. Advanced care planning is really a process. It's thinking about, planning for, learning about what your values, beliefs, and preferences are so that you can encourage somebody else to help you make decisions in the future when you're not able to, possibly very suddenly because of an accident, or progressively, such as in the case of dementia, where your decision-making capacity is altered. Another important decision is choosing who will speak for you. Somebody who's going to be filling out that medical and legal power of attorney. You want to make sure this is somebody that you trust, somebody that can help support you make decisions for as long as you can, and somebody who is able to understand what your values and beliefs are. Now, it is important to document these decisions and review them over time, especially as your preferences and your values and your beliefs could change, perhaps due to different experiences that you have. There are different kinds of supports and services that will be available to you as a caregiver and the person you're caring for, depending on the level of independence. You can see this sort of spectrum that starts where the caregiver is providing the most care. As care needs accumulate, you may find that you need to integrate things like home care, adult day services, residential care, and hospice care. We're going to talk a little bit more about each of these kinds of services to help you plan in case they might be relevant to you in the future. I want to emphasize that family caregiving, you'll see here, is relevant at all stages. The caregiver is involved no matter what the level of service need is. I also want to point out that palliative care, which is something a lot of times people think is synonymous with hospice care, but certainly is not. It's a sort of comfort care that can be applied even as early as when somebody is just receiving home care. So they're not necessarily in the terminal stages of disease when somebody is receiving palliative care. We'll now go through some more specifics about each of these services and supports in the next few slides. I first want to point you to a few community resources. The first one is the Alzheimer's Association. The Alzheimer's Association is a national organization. You can call their 24-hour hotline and get help at any hour of the day, or you can use their online chat feature. The Alzheimer's Association also has a local San Antonio chapter that organizes support groups to help caregivers who may want to be listening to and learning from other caregivers who maybe have been in their shoes and could help you to anticipate future care needs. We also have the Area Agency on Aging. The Area Agency on Aging, like all the other area agencies on aging in the United States, I think there's about 629, provides services and supports to older adults who are living in the community, as well as their family caregivers. If you need assistance finding things like transportation services, counseling, different things that you might need or your family member may need, contact the Area Agency on Aging. Their contact information is listed on the slide. I also want to talk about an important issue that a lot of families face when somebody is still living in the community but experiencing a progressive illness. Driving is something that we associate with independence in the United States. When somebody can no longer drive, they feel like, and they might actually lose a lot of their independence. At the same time, when we're talking about somebody with a progressive illness like dementia, we're worried about balancing their safety with their preference for independence. When we're talking about trying to address driving concerns, we really want to address these before they actually do become a concern. We want to start to have conversations with our family member about what their preferences are if they do have to give up the keys. So for example, in my family, my grandmother was no longer able to drive because she'd had a series of strokes. But whereas a lot of my family maybe just would want to say, oh, well, she could use Uber, she could use this app. She wasn't so comfortable with that option. So we ended up working out a solution with her where she ended up calling somebody who could drive her to her appointments. It was the same person every time, and she could call her on the phone instead of using an app. And this turned out to be a better solution where we were able to balance my grandmother's preferences for her own independence with our concerns for safety. You may find that you need to integrate home care into your care plan. Home care can be things like assisting with medical tasks, like medication management. It can also include things like assisting with shopping. Home care can help somebody stay in the community for longer, even if they need a little bit more help. It's important when you're hiring a home care agency or a home care provider to know what you're looking for them to do and how much time you want their support for per week. You also want to be thinking about how you will pay for this care. Will you be paying privately, out of pocket? Do you have long-term care insurance? Would your family member perhaps be eligible for Medicaid home and community-based services? There's a couple questions you should ask before hiring a home care agency or provider. What is their philosophy on dementia care? Do they talk to people who are living with dementia as an adult rather than a child? What kind of training do they receive prior to working with clients? Use this list of questions as a guide for you, but note you and the person you're caring for are going to have individual needs, and you may have different questions that'll be relevant to ask to get these needs met. You'll notice a theme that getting information is an important part of planning for the future. Another option you may consider is adult day programs. Adult day programs are where somebody receives care, but outside of the home. This might be for half a day, a couple of days a week, or every day of the week. The nice thing about adult day programs is they provide a social environment. There's a lot of stimulating activities that are going on. Things like art therapy, music therapy, most home care, adult day programs that can help to keep your family member engaged. Some families may be in the position where they're still trying to decide whether it's safe for their family member to still be living alone. This is a measure that you can use to help to make that decision. Over here on the left side, you might see an emergent need for somebody to move in with the caregiver, or for a caregiver to move in with them, or perhaps to receive institutional care if you start to notice some of these things. At this point, the need is still emergent. Then, all the way on the other side, you have a non-emergent need. This is starting to get a little bit concerning, where you're starting to worry about the safety of the person if they continue to live alone. You really want to intervene and make sure this person has supports and services available if they're in this situation. It may no longer be viable for them to live alone. Residential care facilities are another option. You have things like assisted living centers that do not provide medical care, all the way up to nursing home facilities, which do typically have a nurse on staff. When thinking about these residential care facilities, you want to be thinking about your family members' needs. You also want to be thinking about how you can pay for these things. Typically, assisted living is not covered under medical insurance. You might have long-term care insurance, however, that would cover this cost. Skilled nursing facilities may be covered under Medicare in some cases, such as after somebody was released from a hospital and they need rehab services that may be connected to a nursing facility, or it might be covered under Medicaid. In between, you also have care homes, which are more personal, smaller residences that do provide care to somebody who's living with an illness that's disabling. Similar to when you're hiring a home care agency, you want to be proactive and ask a lot of questions and do your research when you're looking at residential care. You may visit a care facility or multiple care facilities. You might want to stick around and observe the residents interacting with staff. Something I advise families to do is try not to base your decision based on what the entranceway looks like. So if you have a gorgeous sitting room in the entrance of a facility, that doesn't necessarily always translate into the best possible care. I think culture and staff training are really important parts of choosing a residential facility. Make sure to ask about these features as well. There are tools to help you shop around if you're looking at nursing home facilities. Medicare.gov provides ratings on different nursing homes that you can compare using a star rating system on different features that may be important to you. You can also learn which facilities may have a history of mistreatment. This is important to know for the safety and for the safety of the person you're caring for and for your own sense of peace. When choosing residential care, it's important to remember that residents have rights. They have the right to complain, to be informed about their care, to privacy. You may need to be your family member's advocate if they're no longer to do so on their own. I encourage you to visit the Consumer Voice for Quality Long-Term Care to learn more about residents' rights. This is particularly important during the time of COVID-19, where there's a lot of change going on and different considerations that you may need to ask about in order to look after the safety and well-being of the person that you're caring for. Things like policies around visitation, if there are enough staff to enable telecommunication between you and your family member, and things around the use of protective equipment. Lastly, I want to talk about palliative and hospice care. Palliative care is an approach to care that's focused on improving quality of life for patients and their families who may have life-threatening illnesses. There's a saying that it's not just about adding years to life, but also lives to years. This is the philosophy of palliative care, which can still be received even when somebody's receiving disease-modifying or curative treatments. Palliative care is focused on treating and preventing physical pain, as well as other sources of suffering, from psychosocial issues somebody may be experiencing, as well as spiritual challenges. Hospice care, on the other hand, typically occurs at the late stages of a disease. It's care for the patient, the caregiver, and the family. It can be provided wherever the person is currently resided and is a Medicare benefit. This is a diagram that can help you think about where palliative care may be relevant versus hospice care. As you can see, you're still receiving a disease-modifying treatment even while you may be receiving palliative care. Hospice care, that disease-modifying treatment isn't quite as relevant. And then we also, what I like about this diagram, it does include bereavement support. As we said, for both hospice and palliative care, support for the caregiver and the family is still relevant. Even after your family member or loved one has passed away, it's important to recognize that you too may need bereavement support, perhaps counseling or support groups. If you're currently listening to this talk in San Antonio, you'll be glad to learn that you're surrounded by a lot of great community resources. Here at the Caring for the Caregiver program, we're focused on education and providing social support to family caregivers through a strengths-based approach. You're currently attending our Essentials of Caregiving course. This is a lecture series that goes on throughout the year on a monthly basis. We also have our Los Amigos Memory Cafe. This is currently being held virtually, but has occurred in person in the past and is focused on providing a safe and sociable environment for family members and persons living with dementia to share and enjoy each other's company. We also have our Learning Skills Together workshop. This is an online program to help family members to provide complex care skills to somebody who's living with mid-stage dementia, although all caregivers are welcome. You can learn about how to do transfers, oral hygiene, managing incontinence, and more. We also have WellMed Charitable Foundation, one of our partner organizations. They provide the Stress Busters program, which is a 9-week course for family caregivers to help to better manage stress and better cope with challenges from caregiving. And as we've already talked about, there are support groups locally through the Alzheimer's Association. Before we begin our discussion today, I want to share a little bit about the research mission at the Caring for the Caregiver program. Caring for the Caregiver is an academic service center. What this means is that we provide education services like this one, but we also conduct research. Our research is based on the needs that we learn about from our community. It helps to improve our services and can help to inform the larger field and other programs like us nationally. We also think that our research helps to improve our services. If you'd be interested in learning more about our research mission, please contact us at the link below. I'd also like to share with you a research opportunity that we have going on currently. We're trying to learn more about the social context in which caregivers provide care, including their relationships with the person they're caring for, their family members and friends, and how this changes day to day. We want to know how differences in these relationships can affect a person's health. Caregivers who are interested in participating will complete 2 weeks of daily diary surveys that take about 10 minutes each. For 5 of those days, you'll also ask to provide 4 times daily saliva samples. We know this is a lot to ask. At the same time, by participating in this research, you'll help us to better understand how social context of caregiving, including your relationships, can affect your health. If you're interested in participating, please email me at meyerk1@uthscsa.edu, or you can find out more about the study and if you're eligible by following the link. Thank you for considering this opportunity.